Okay.
All right, I'll call this meeting to order. It is Tuesday, April 8th, 2025. It's 1 o'clock, and we're here to discuss Panhandle Health District strategic planning. And I'll turn it over to
wonderful.
Dr.
Well, I'm here to
Fletcher.
actually mostly focus on this meeting. And Leslie Duncan keeps calling it a workshop. Frankly, I don't care what we call it. I think you guys are accustomed to calling things workshops when you have like little think tanks and you work through problems or issues. We'll call it whatever you want. We can call it a workshop. But I think we can all agree on a couple of things. The management or mismanagement of COVID was catastrophic. We might also all agree that the reputation of public health was suffered. We might also all agree that there is intrinsic societal value to public health. I mean, I think there is. And I can give you my reasons for thinking that if they're not, obvious. So the endeavor is worthwhile treasuring and fostering and promoting. That is to say, the endeavor of public health. But we've got some repair. There needs to be some measure of readjustment of the enterprise of public health vis-a-vis the citizenry, because it's taken a hit. And so the purpose of this workshop, shall we call it, is to think about what we can do to improve the reputation. How can we alter our mission? And in fact, a mission statement is one of the exercises I'd like to carry out during the workshop. Let's just see what our mission statement is, read it, reevaluate it. Is this what we want? Do we want to modify it? Whatever. And then some heartfelt reflection on what we are up to. Now, the standard portfolio, as you'll hear from Eric, I see Eric's coming in a few days. I don't know why we couldn't have collaborated our efforts, but that's neither here nor there. There are the public health clinics. There's the septic. There are the restaurants. There was an EPA Superfund project that was up your way.
They still do it.
They're still okay.
Yeah.
Now, the last three items, well, actually, all of those items to some degree or another, the health district is really operating as a subcontractor. So for sure, with the Department of Environmental Quality, all of the septic and solid waste management, these are not policies or regulations that are developed sui generis by Panhandle Health. We're just simply subcontractors. And for that matter, even DEQ is being subcontracted by way of a kind of a larger scale from the EPA, federal. And some of these statutes date back to the middle 20th century. So if we're going to brainstorm over environmental quality and septic, well, that's really not in our bailiwick, truly. Largely the same story applies to restaurants and food handling. Your food handling regulations and statutes, again, a lot of it comes USDA, and then it's handed down. So by the time you get to a health district, again, we're just subcontractors doing the bidding of higher level governmental organizations. So that leaves us with the clinics, where in fact we might have an impact. And I have done, in the capacity of being the chairman, I've taken the opportunity of doing some secret shopping. So I've visited the clinics, health clinics, just randomly. Very unscientific. Okay, it's just Thomas Fletcher happened to walk in. I did not announce myself. I didn't even tell people who I was. I just wanted to see if the building was clean. I wanted to see if people were smiling, acting appropriately. I don't know, just secret shopping. And I found, in fact, the facilities are clean and people are polite and friendly, but the clinics are empty.
Empty without
Without
patients.
patients,
People.
yeah.
Of people. Now, from this point, we can take off in a number of directions. I'm a retired physician, but I was in private medicine. And the group I was with, we had 20 clinics. And we had gross billings in the neighborhood of $250 to $300 million a year. So it was a pretty big operation as professional corporations go. And you could do some secret shopping in one of our clinics. And as I did, because I was medical director, I would want them to be clean. You know, if you're going to go to a doctor's office,
Yeah.
I mean, really,
Yeah.
I don't know, I'm kind of funny that way.
No. No.
And you want it to be polite, the receptionist. I mean, to be quite honest with you, the physician you have in the background isn't worth anything compared with that receptionist who greets you and with respect and promptly and there's a certain decorum that is expected. But our clinics at least had people, patients.
Right.
We call them patients.
Yes.
In the olden days.
Mm-hmm.
Well, there are no patients. Now, why is that? I don't know, to be quite honest. I mean, we could throw out a number of conjectures.
Mm-hmm.
I'll throw out a few. You may have some. Maybe people don't know that these clinical services are available. So, in other words, we have a PR problem, just advertising.
Mm-hmm.
It's possible. I'm just throwing out hypotheses.
I would agree. I think I would
Okay,
agree.
here's another one. Loss of trust.
Mm-hmm.
I mean, subsequent to the COVID fiasco. I don't know what it was like 5 years ago, 8 years ago, 10 years ago. I just don't know because I wasn't here. I didn't do any of my secret shopping then. So I don't have multiple data points and a timeline to make an assessment. I just don't know.
So one of the things I think is what's lacking is what services are provided. I don't think people understand what maybe if they knew what was provided and who could access it and how it would benefit them. I think that would be a good start.
That goes back to my first hypothesis. Yeah, sure, that could be. People, they just don't know. They don't know that this is available. Mm-hmm. And I think that's a keeper. By the way, none of these hypotheses are mutually exclusive. It could be all of the above. Mm-hmm. Here's another hypothesis, and that is, and again, this is kind of related to the shock and trauma of the COVID experience. But a lot of people are just more distrustful of organized medicine. Mm-hmm. They lied to us. A lot of doctors lied in a big way. I think I can say this because of our preliminary conversations about, the economy. Mm-hmm. That's why I'm saying what I'm saying. Mm-hmm. So it could be that there is some measure of loss of faith in just cartel medicine, establishment medicine. And it has nothing to do with Panhandle Health, you understand. This is just, they just happen to be a Venn diagram, and one of them is a much bigger circle that engulfs. Now the health district becomes collateral damage to just, all of medicine. Here's another hypothesis. So 2 legislative sessions ago, $800 million was put into the kitty of Medicaid expansion. Mm-hmm. And so if you have all this money, you basically now have, a credit card that allows you a la carte medical services. Just pull your Medicaid card out and go get whatever medicine you want from whomever you want.
Correct.
So why go to a public health clinic where there may be some stigma. You know, after all, that's where people who have venereal diseases go. I mean, I'm just talking out loud. I'm not trying to cast aspersions. Again, remember, I said I actually believe in public health.
Yeah.
So if I come across as critical, please appreciate that it is a tough love, if you will. I mean this in the spirit of what can we do to fix it.
Yeah, and that is a stigma that people have.
I think it is a stigma. So if you've got your Medicaid card and you can go wherever you want and get boutique medicine, well, then do it. That might be another reason why the clinics are empty. I don't know. Now, the amount of monies that are being sprinkled upon the Medicaid program is in flux. And as a matter of fact, Seth Grigg is going to moderate this work session. And I've asked Seth to give us, what the upshot of this last legislative session and its fiscal impact on healthcare in Idaho. And he'll be in a position to share with us what he thinks this will be. You know, the Jordan Redmond bill, and there were a number of moving parts, and I'm not even sure I understand how all those moving parts fit together. So what I would propose for the workshop is for us to drill down on the clinical services. Do we keep them or not? And by the way, Health District 2 has done away with them. And one of my buddies, Vicki Purdy, who is a commissioner and on the health board in District 4, you may know her. She's the vice chair of the Idaho GOP. She's right underneath Dorothy Moon. So she's one of my confidants, and we talk about things. She'd like to do away with the clinics also. She said they're a money loss. It's just and that is quite possibly true. We're losing a lot of money. You know, if all you have is lights on and you're paying employees and no one's in there,
that's right.
I mean, let me just share with you, and the data I'm going to share with you is not new, nor is it proprietary. I would invite you to do your own AI search using whatever your favorite AI search engine is. You know, we have the most expensive health care on the planet. Our longevity is in decline for the first time in at least 100 years. Particularly white males. Doesn't that make you proud?
Yeah.
We are living shorter lives. Go figure. Take, for instance, Spain. In Spain, on average, they live 6 years longer than Americans. And they spend only 22% of what we spend per capita on healthcare. So to say, well, you have all these programs, women, infants, children, you know, WIC programs, whatever. Are you getting your money's worth? I don't know. I mean, but the question is not absurd. I mean, I think the question is legitimate.
So that's they're only spending 22% of what we spend?
Yes, sir.
Wow.
Or another way of putting it, they're spending 78% less. I just picked on that one example. I mean, we could go down all of the countries of the first world countries or second world. I don't care. You can even pick on Cuba if you want. We are horribly expensive in our health care, and we're not getting much for it. Again, I'm not picking on Panhandle Health.
No.
Please understand that. Yeah. I'm just saying clinical services, are these redundant? Are they being used? Is it a good dollar value? I mean, I think these are legitimate questions.
Oh, absolutely.
I mean, Eric is going to come and give you the budget. Well, he's going to give you the budget in the sense that he has it formulated. This workshop is going to be sort of meta budget. Let's think, which is why I want really all of you guys, all 15 of you, to come to the workshop. Because we need to get all of the participants who are in this enterprise in the same room at the same time and ask these questions. Or if we do keep clinical services, maybe we need to do something different to compete with cartel medicine. What if we went the route of integrative medicine? What if, in fact, you provided a really upscaled version of nutritional health, where you would have people who come in with different conditions, and you can tailor their nutritional support in such a manner to meet their health issues? There are, in fact, diets that can mitigate against chronic inflammation, not least of which is avoidance of omega-6 polyunsaturated fatty acids, and so on. I mean, there are a lot of things. My wife has actually, she once upon a time was an ICU nurse in a level 1 trauma center. Actually, that's where we met, in a level 1 trauma center. And she's now become a naturopathic vet. So she does all kinds of, health care for animals, four-legged creatures, with herbs and other remedies. And a lot of these have overlap with humans. For instance, gut health. We can talk about gut health, leaky gut syndrome. Darla could give you a whole lecture on leaky gut in cows and pigs and whatnot. So I don't know, maybe that's another thing we could consider. I mean, I'm just throwing thoughts out. I'm not saying I have the answer, but this is what we need to have an adult conversation. How do we want to move forward?
Yes.
And we're spending the public's money.
And we're spending the public's money.
And so how well, where should we be spending it, and how well should we be spending it?
You've got it. You've got it. So I was proposing that I want Eric to start off the morning. Oh, let's talk about some logistics here. I think you've got a feel for the workshop. Let's talk some logistics here, and I really do want your opinion. How long should this be? Should it be just a half a day, just morning, afternoon? Should it bridge the noon hour? It's going to be a declared official meeting, so it's open public, so the public will be there. We can't not have them there. We want them there. But do we want them to be able to speak? Do we want them to be able to speak before we get started, after we're done, in the middle, anytime? Or should they be only allowed to submit their questions in writing? And Seth Grigg sort of rifles through them, and there'll be, 50 questions about chemtrails, but we can reduce that down to one. As I've gone around, seems to be chemtrails are in everyone's mind.
Yeah.
In any event, not that we have jurisdiction over that. Tennessee is discovering, and for that matter, Florida is discovering you can even make it a felony to do chemtrails. It still doesn't do any good because they're 40,000 feet in the air. What are you going to do? Shoot them down with surface-to-air missiles? I mean, we see them. What are you going to do? You can outlaw them all you want, but there they go. Anyway, I tell that to people all the time. What jurisdiction does Panhandle Health have?
That's right. Yeah.
And I don't know if the state owns the airspace above, or is it the federal government?
I don't know. I just know that the states that have outlawed them, like Tennessee and Florida and some others, they still can't stop it. You can't, again, unless you have some air defense weaponry. I mean, I'm not trying to be a smartass here, but there's nothing you can do. It's the ultimate in extra-jurisdictional. That's like satellites. Even I don't want those satellites over Idaho space. Oh, right. Okay, anyway. So when do people talk? Should they talk? How long should the meeting be? the format, and Leslie Duncan asked me this question, and I struggle with it. How do you want so it's going to be in the conference room in Kootenai County building, there on Government Way. All right?
Okay.
How do you want the room set up? Now, I'm going to tell you some of my bias. My bias is that the 15 commissioners should be the principals. You guys are the principals. And that's set up by statute. Mm-hmm. We take our marching orders from you. So in a sense, this workshop is really for you. It's just that we're calling it Panhandle Health because that's kind of the topic. But I'm not going to be, I mean, I'm going to make some preliminary comments to kind of stage this setting. And some other, and Seth Grigg is going to make some comments about money and the legislative session. And then we just turn it over. It's now, okay, where do you want to go? And the topic will be the clinical services. Now, maybe we're done in 15 minutes. Maybe the decision will be, you know what, it's not a dollar value. Let's shut it down. Mm-hmm. Okay, enjoy lunch. I mean, I don't know how this is going to work out. I'm not going to tell you what to say or how you should say it, or whether there will be disagreements amongst you guys. I mean, I don't know.
One thing that I think is critical, and maybe you're going to say this, but Eric has been asked to generate the numbers for the past 10 or 15 years. How much was spent? How well was it utilized? And so that you can see the direction.
Right.
Because we don't know if COVID made an impact.
Right.
That's the other thing.
Thank you. She's absolutely correct.
Yes.
Ostensibly, Eric will have done some analysis on the clinics and is going to go back at least 10 years.
Okay.
So we can track it.
Okay.
What's happening? Can we trend it? Mm-hmm. And that's a vitally important element here. So, what should be the arrangement of the room? I don't know. Should it just be an audience of chairs and then you're sitting out there with all the public? I mean, that's one way to think of it. I don't know. You're just a citizen. Mm-hmm. Should you have a name tag that allows only you to speak? I don't know. I'm trying. Look, I'm not trying to be catty here, but there are some real logistical issues because for the most part, your voice does carry more than just an average citizen. Mm-hmm. You were voted to be here. Right. So in reality, you do represent, I don't know, 6,000 people.
Yeah, exactly.
I mean, I don't know. You're new to the game. You've been here for a while. You must know how many people voted for you.
I can't even remember now.
I know, but it's more than but it's more than just yourself. So really and truly, as a commissioner, you really do speak for a bucket of people. Mm-hmm. I just speak for my 3 commissioners who appointed me. That's it, and I do my best to do their bidding. By the way, so you really should be somehow signaled out different in the ergonomics of the room. Mm-hmm. Now I'm going to ask Seth what he thinks, but what is your thought?
Yeah, I think we should
either we're set up all together or name tags. I mean, something to identify the commissioners versus.
Do we perceive there's going to be a lot of public?
I don't know.
Yeah.
Well, since you asked that question, do we Zoom it? Not Zoom it? Do we let people speak? When do we let people speak? Do we even let people speak? Mm-hmm. Do we let Zoom people speak? I can tell you, Leslie Duncan felt pretty strongly that you should not let Zoom people speak. Mm-hmm. It just gets out of control.
It would.
She said, I don't care if people who come to the building are in the room and they've signed up, then they deserve a chance to speak. Mm-hmm. But the Zoom thing, Lord, you might have hundreds of them and they raise their little hand and then it just...
They could be from anywhere.
And they could be from anywhere. So she was not in favor of that. So if you Zoom it, at least it's it's read only, if you will. It's,
Yes.
They can look at it,
Yes.
but they can't
They can't interact.
interact.
Yeah.
Yeah.
If you want to interact,
Come.
put your clothes on,
Mhm.
park your car, and come in the building.
Yep.
And I actually think I'm pretty strongly in favor of that
Mhm.
position.
I
Yes.
agree.
Me too. I agree.
So maybe have some tables that are up front. The 15 of you sit there,
Mhm.
and interspersed would be the 7. Well, of course, some of you will be doing double duty because you'd be on the board and a commissioner. Tim Bertlin is also double duty. But the rest of us are at-large, appointments. By the way, what happened to that bill? There was a bill that actually had a reading in the House that would have outlawed
I
Yeah.
saw that.
at-large health district board members. Did that? I don't know. Did it?
I haven't seen it yet.
I don't even know if that really made it through. I don't know
Yeah, I don't know either.
where it went.
I mean, fire me. Fine, go ahead. I know Leslie Duncan said, look, I have so much to do. I'm happy that people like you and Dr. Johnson are participating. Thank you. So, at least from the perspective of some commissioners, they're happy that there are citizens who volunteer.
Yes.
And for commissioners to do it is also fine. It's great. In some sense, you have more fiduciary responsibility than I do.
Yeah.
I mean, your feet are on the fire.
Mhm.
Okay. Anyway, so maybe some tables set up for the commissioners, and maybe also the board members. So that'd be roughly 20 people, and then there's and then Seth would be at the front, and then people are in the back. I don't know. Does that sound like an arrangement?
Yeah.
Will we be facing have the board members and the commissioners facing the audience, or are we going to be with the audience?
Well, that's a good question. How would you like to see it?
I think it would probably be better if we were facing the audience so that we could see people's questions, see who's asking the questions instead of, having to reach around, listening around. If we have the public speaking.
Okay. So then that begs the question, when do we allow public to speak?
Well, here we allow them to speak after the hearing, or after the meeting, but we could, it's nice to get their ideas up front instead of making a decision and then getting their ideas after this decision. But, have them speak first, possibly.
The bill died.
I'm sorry, what?
The bill died.
That's what I was.
Oh, it died.
Yeah.
Oh, thank
That's
you.
what I was thinking.
So repeat what you just said. I'm sorry.
It would be, instead, it would be good to have them speak first, probably, so that, give them a chance to get what's on their mind, and then possibly have to be able to make the decisions afterwards.
Okay. And quarantine it to just before, not interspersed, not let them be part of a dialogue, a dialectic.
Yeah, that.
I don't look, sir. I'm not trying to be argumentative. I'm just.
But we're trying to make a decision, right?
Yes.
We're coming down to a decision that we have to make.
Well, that's another question.
Mhm.
That's actually a great question. Do we? We don't have to.
Mhm.
We don't even have to have an action item. It's just a workshop,
Mhm.
brainstorm.
Okay.
Yeah.
In
So
fact,
is this what
in
this
fact,
is a just basically a workshop, and we're not going to make a decision and maybe make it
If
later?
it were left, look, I'm going to do whatever you want.
Mhm.
If you want there to be a decision, so be it. I'll throw that in. I'm going to talk to all 15 of you, and I'm going to collate. I would say at this juncture that to mandate that we have an action item and make a decision is a minority position.
Mhm.
Because I don't think people are quite ready to pull the trigger on that. I think it's enough that we brainstorm it, give it some thought, maybe in 6 months, maybe in a year.
Okay. So this is more of information.
And it also, you know, it leaves, as you were saying, anybody in the public, if they have their own input or, you know, if we decide to make a decision later on, in between that time, the public can either raise their concern or not.
That's right.
It gives them more of an opportunity to speak too.
They can raise
however way they see
they can
it.
raise their concerns kind of, you
Yeah.
know, with us,
or
our
not.
public can.
Yeah.
I wholeheartedly agree with that. And to add to that, the entire enterprise of medicine and certainly the enterprise of public health is a moving target right now.
Yeah.
It is a moving target. Every day we can read about how things are happening. So it's the landscape of public health today, one can imagine, will be real different 6 months from now or a year from now. So rather than force an issue, well, we're going to do this.
Right.
Well, why don't we talk about and then reconvene and have this conversation again? Specifically as it relates to the alternative health care. That happens to be my favorite.
Yes.
Truth be known. I think if you gave people an alternative style of health care, your clinics may fill up. Let Darla do some of her naturopathic veterinary medicine.
Now, are we going to come up with decisions that we were going to make later? Are we going to come up with points? Well, do we want to do A? Do you want to do B? Do you want to do C?
Yeah.
And then to be able to give the public a map of where we're going.
I think
You know, what decisions we have to make and what's, you know, what process we're going through.
Well, here is my short answer, sir. You make it happen. It's your meeting. As Seth Grigg is a professional. He's really good. I think he's going to bring. I think he's going to bring ideas out of the Commissioner Zimmermans of the world. And there may be options A, B, and C. Sure, I can see that happening. You can prioritize them. Absolutely, that's well within the scope of this exercise.
Okay.
And it would be incumbent upon me then to summarize all of the discussions and to shoot back to you then an organized, if you will, summary of what transpired that day for your files and for your thoughts. And then, I don't know, then 6 months, a year from now, we revisit that summary. That's how I see it happening.
Okay.
But what you just said is absolutely spot on. Sure, make it happen. Options A, B, and C.
meeting in minds. Everybody throw out their ideas, and then we start.
Which is part of the reason why I don't want to have an action item.
Yeah.
I don't think we should have.
No.
It should just be a discussion.
Yeah.
There should be a lot to discuss.
Yeah.
Not to mention it'll be cathartic. You know, a lot of the public are just pissed off.
Yeah.
They are, and so it's useful for their psychology to say, you know, you guys messed up. Don't do this moving forward. Otherwise, we will for sure never visit one of your clinics. Okay, so what I'm hearing is maybe some sequestration of the commissioners and the board vis-a-vis the public. They should be oriented towards the public. Seth then can be like a circus barker. He's in the middle of the thing, revolving. But he's again, he knows what he's doing. He can speak in a circle. The public speaks. before, during, after, limited times, unlimited times?
Maybe let them speak before and
Mhm.
after.
Before and after,
Yeah.
but not during.
Yeah.
I can buy.
Just so that it gives everybody time to discuss everything and all their ideas and
Just so
I
we
actually
move
like
forward.
that.
Yeah.
I like what
Yeah.
you're saying there, because if you let them engage in a dialectic throughout, well, we won't hear from you. There's
Right.
only 15 of you,
Right.
and there's
Mhm.
100 of them,
right.
Mhm.
and they may not be as disciplined.
Mm-hmm.
Mhm. Yeah, I can see that.
Yes.
Okay, I like that. Okay, so before and after, but not during.
Yes.
Yeah.
Okay, okay, I like that. Duration and timing in the day. And let me tell you my thinking here. Originally, I was going to have this thing start early in the morning and go all the way to the end of the day. And Leslie Duncan said, "Oh, Thomas, you are way too optimistic." as if you can't tell. I take a lot of advice from her. I find her intelligent and measured, and I don't know. And she's easier to get to than you guys. I find you the same, but it's a long ways to get here. In any event, it got shorter, but then as time goes on, I'm thinking of even making it shorter still. And then finally, actually, the Board of Commissioners in Boundary got me to thinking, just make it either AM or PM. Don't straddle the noon hour. And I thought, well, that's actually pretty reasonable.
Mm-hmm.
I can't say I disagree with that.
Mm-hmm.
Maybe 9 to noon or 9 to 1.
Yeah.
I agree.
As
with that.
opposed to
agree.
10 to 2.
Oh yeah.
Yeah.
You see what
Yeah.
I'm saying?
Yeah.
Because then that gives you your afternoon. Okay, so 9 o'clock, you can get there. You can get to the county building by 9.
Mm-hmm.
And then, I don't know, if there's a lot of exuberant discussion, maybe it goes until 1. I don't know. If it fizzles, we're done at 12.
Yeah.
Mm-hmm.
Do you?
Yeah,
Are you on
I
board
agree.
with that?
I agree.
Definitely on.
Okay. I thought that was a good suggestion of those guys.
Yeah.
Okay.
Yeah.
I think I'm about done. Do you have any questions are there things other than the clinical portfolio that you want to discuss?
Not that I have any.
No.
I mean, solid waste removal. I mean, I don't know. There are other components to the portfolio, and I'm open. I'll talk about anything you want.
No, I don't really have.
But when you think about the trauma of public health in this country, maybe even the whole world, but certainly this country, that revolves around, the clinical manifestations of, infectious disease and, whatnot. I mean, look at what's going on in Gaines County, Texas. Can I share with you some things about Gaines County, Texas?
Sure.
Yes.
And I'm only learning this myself. I am not an intrinsically smart person. I promise you. My area of medicine was not public health or infectious disease or virology or immunology. I'm not an expert in any of those things. However, I do enjoy reading, and I have moderately, shall we say, effective reading comprehension skills. So I read a lot. So it's interesting, this measles outbreak in Gaines County, Texas. Leading up, so this is a Mennonite community. They don't vaccinate. Okay. A lot of those people actually moved to this region because they were in flight of vaccine mandates from California and other states. They actually were refugees. They were vaccine refugees. Literally. but they were haunted or hunted, depending upon how you want to look at it. And so over the last many months before Kennedy became HHS secretary, well before, because you see the case I'm going to make is that he was ambushed, an effort was made by health officials, their version of Panhandle Health, the health district, came in there and administered 15,000 MMR vaccines. Now you have to understand that the measles component of the MMR is actually a live attenuated virus. It's a single-strand RNA creature. It mutates. It is not stable. Heck, human beings mutate from one generation to another. Just look at your kids. They're a little different. It's natural. It is the way of life. Every generation's a little different. So it is with RNA viruses, which are a whole lot less genetically stable than DNA. Double-strand DNA is a much more stable molecule than single-strand RNA. So single-strand RNA just changes. Well, this is a live attenuated virus of which the Edmondson strain that was originally developed in 1991 is very different than what went into those babies' bodies in 2024. Very different. It is not the same. Mm-hmm. And the clinical safety and efficacy trials have never been done. Well, and how would you do them? It's live attenuated. It's changing all the time. As a matter of fact, it's so different that it's actually MMR 3, version 3. Well, it turns out that the vaccinees, the creature who got vaccinated, a third of them are still shedding virus a month later. So if you vaccinate 15,000 people, a third of those, 5,000 of them, are shedding measles. And they're in a community of people who are not vaccinated. Well, what do you expect? Mm-hmm. They're going to get measles. Mm-hmm. Yep. You follow what I'm saying?
Yeah.
And then along comes Kennedy, and he's got this dumped on him. Look at this. You're arguing against vaccines, but wait a second. This is a fabricated. This is. There were some conditions that were set up that made it happen. Mm-hmm. Something I learned this morning. I almost woke Darla up to tell her this. It was one of the first things. She wakes up gradually. What time is it?
It is the first thing I heard.
I said, you're not going to believe this. You remember Deborah Burke's Scarf Lady?
Yeah.
Remember and she is not a vaccinologist or an immunologist or any of those things. She was on loan from the military. She was Department of Defense. She was appointed to the faculty of Texas Tech Medical Center 9 months ago. Gaines County is in the shadows of Lubbock, Texas, way over there in West Texas. Now, low be me to say that this bureaucratic monster was actually part of some conniving. Now, that is truly me talking conspiracy, I grant you. But it is awfully suspicious that of all people on the planet, Deborah Burke's happens to be in the neighborhood of where you have this measles outbreak. Wow. That's just peculiar. Awfully darn peculiar.
Okay, I can't help it.
Go ahead.
You cannot talk about measles without quoting the facts as they are presented from the CDC figures. In the last 25 years, how many documented cases of measles deaths directly related to measles have we had, Thomas?
Well, now we've had 6.
5 before that.
But yes, but there was right.
And how many documented cases of death have we had related to the MMR?
In VAERS, which is only reporting 1%, thousands.
Thank you.
That's right.
And that's not opinion, that's as reported by the CDC. I just find that is alarming to me that parents are not told that as part of an informed consent. It's documentation. It's not somebody's opinion. I just think it's not right to give that kind of information to parents before they make a decision. And I'm not saying don't vaccinate your children, but give parents real information.
Well, anyway, we've gone far afield. Do you guys? I've taken up enough of your time.
When is the date again for the workshop?
May 10th.
May 10th. Yeah. I believe I already.
And now I think we can pin down. It's going to be 9 a.m.
Yep.
to noon.
Okay.
Or
Okay.
noon plus.
Yeah.
How does that sound?
Yep.
That sounds
I think
great.
that's enough time,
Yep.
particularly if all we're going to do is drill down on
Yep.
clinical services.
Yeah.
Yep.
I think we can flush that out.
Yep, I agree. It's going to be interesting. There's a
Yeah.
lot of
It's going to be
possibilities.
real interesting. Because I want to
I
get.
liked your idea with the nutrition.
Yeah.
I
Me
really
too.
think that.
Well, that's my personal
Yeah.
favorite. If you're going to
Yeah.
stay in the game, then let's
Yeah.
at least offer the public something genuinely different.
Exactly.
You want your pap smear, go to some doctor to get a pap smear. You want your vaccine, go to some doctor to get your vaccine. You want your whatever, I don't know, go to your doctor, your boutique doctor to get those services done. That's fine. But what could public health do that's genuinely different and put you in a different light?
Yeah.
You see where I'm coming with this?
When you don't have that in the out, you don't, you have to go search for it to get it. I mean,
You
it's
do.
something that there's not very many doctors that do that. I mean, it's.
Well, as it happens, Duke Johnson is one of them. You happen to have on your board of Panhandle Health, and you can thank the Kootenai County Commissioners for this. Duke Johnson, who happens to be her doctor, by the way. Remember, she's a fanatic when it comes. In any event, that's his forte, is integrative medicine. Now, I'm not saying he's going to take over, but I mean, at least he can give you some intellectual guidance. And not to mention, I'm also on board. I mean, I've taught myself a lot. And so you're not completely rudderless. If you want to go in that direction, you've got some built-in, warriors. I'm not going to claim to be an expert. That term, expert, gives me nausea. It's only because people like Tony Fauci claim to be experts, follow the science. It gives me nausea. And then let the ideas stand on their own. In other words, if you are providing a service that has value to the people, then then your clinics will have people in them.
That's right.
Yes.
And there's no stigma with that.
Yep.
Exactly.
I mean, there are simple things you can do. For instance, commercial baby formula is horrible. I mean, it's genuinely horrible. Well, there are things you can do to make your own baby formula. I mean, don't be resourceful, folks. Anyway, I'm just throwing out ideas.
Yeah. And a healthier community is I'm going to have to go to the doctor all the time. Like we're.
Yeah.
Right. And it would be in keeping with what Secretary Kennedy is attempting to do. I mean, he's trying to just make us healthier. I mean, this is certainly part of, if you will, the zeitgeist of this moment. Speaking of zeitgeist of this moment, I can't believe Brad Little signed into law the Medical Freedom Bill. Yes. Again, I hope my politics are not...
No.
I hope we're in concert
no.
here.
Yep.
Yeah.
Okay.
We are.
Turns out
Yeah.
Leslie Manukian's a friend of mine, so I was cheering her on. Anyway, so there you have it.
Okay.
Well,
Okay.
thank
hey,
you
thank you very much.
for
Thank
your
you.
time. And I guess, do we call
Yep,
the
we're
meeting to an
adjourned.
end?